Did you know that menses pains can be ranked according to intensity and according to what actually is the underlying cause? Today we will briefly rank depending on how intense the pains are, and also talk about underlying causes. There are two types of menses pains, or otherwise known as dysmenorrhea. Firstly is the obstructive dysmenorrhea, which is usually caused by a discrepancy in the angle where the uterus and the cervix is shaped in such a way that the menses is unable to exit completely, causing obstruction in the opening. So the uterine wall starts to contract violently, causing menses pain. And this condition usually goes away when the patient grows up, because it's usually experienced during the teenage years or adolescence years. But once the patient grows up into adult life, this type of menses pain usually goes away and is usually considered mild. Secondly is the more intense type of dysmenorrhea or menses pain known as hemorrhagic dysmenorrhea. Hemorrhagic means bleeding. So this type of dysmenorrhea usually comes with heavy menses and also intense menses pains. So conditions such as adenomyosis, endometriosis, chocolate cysts, intrauterine adhesions, uterine malformations, and so on. But these five are the more common, statistically more common conditions that cause the most intense pains. Before we talk about how we treat them, let us briefly rank based on the intensity of pain that is experienced during menses. The most intense pain, menses pain causing condition, firstly is the adenomyosis. If you have adenomyosis, or from another perspective, if you experience intense menses pain every time you have menses or on your period, you most likely have adenomyosis. Secondly is endometriosis. Endometriosis is simply the condition where the inner lining is found to be growing elsewhere outside the uterus, and this usually also causes intense menses pain. Thirdly is the obstructive dysmenorrhea, which means the angle between the uterine body and the cervix. It is formed in such a way where it's causing build-up of menses, and this also causes violent and contractions leading to menses pain. That's third on this list. Fourthly is due to intrauterine adhesions. So adhesions, which means there are web-like structures or ligament bands that are forming inside your uterus between the two endometriums. It's like a spider web. This also causes intense menses pain. Fifth is uterine malformations. So uterine malformations include naive uterus, septate uterus, bicornuate uterus. All these type of uterine malformations also cause menses pain. Now on the list, we will be talking about chocolate cysts. The chocolate cyst doesn't cause intense menses pain. It's actually causing the least form of menses pain. But usually chocolate cyst doesn't come alone. It usually comes along with some other form of disease on the list. For example, chocolate cyst and endometriosis, chocolate cyst and adenomyosis. It usually comes accompanied with some other form. But if you have only chocolate cyst, you usually don't have a lot of menses pain. I hope this list can help you and help you in your diagnosis. And also, if you feel like you have one of any of these conditions, please go to your gynae to get checked and also treated. So all of these conditions can be easily treated and diagnosed using 4D panoramic ultrasound to look at the uterus, see what condition is actually going on that is causing the menses pain. And then using either hysteroscopy or laparoscopy, depending on your condition, we can remove the lesions, remove the chocolate cysts, and then these menses pains will go away.